Many of the members of our community are one job loss away from homelessness, one job loss away from poverty. And the effects of poverty, the tentacles that poverty extends into our community, some of those include drug addiction and domestic violence. Because when you're hopeless and when your family unit breaks apart, it can be really easy to try to find an easy escape. And so the stigma that mental health has in our city, in our county, honestly in our country, is something that we need to work on. And as a city, I think it's part of our duty to make sure that we don't sweep these folks under a rug, that we don't zone and put mental health treatment facilities in neighborhoods that are blighted or otherwise places that we would say, well, this is where the bad people go. So that's first. I think we need to create an equitable system of health care into which physical and mental health care are treated similarly. So what the city can do in terms of that is certainly work with the county to get that triage center open. I also get asked often and said, what do you think about the city taking positions that the federal government or that the county or that the state has jurisdiction over and the city doesn't? I said, well, it's an opportunity, and I believe it's a responsibility of not just city leaders, but community leaders to stand up for the issues that affect our residents. And so if federal funding for mental health is one of the things that affects people in our community, whether we have jurisdiction or not, I think it's appropriate to pass a resolution that says that we support a particular program or more funding to come into our community, because that says that we need the resources. So we need to work with the county, we need to work with our federal agencies that deal with mental health, and certainly that crisis triage center needs to be open soon.